Hello, my name is Anessa. I'm going to be your nurse today. Can I get started with your name?
Courtney.
And your age?
16.
Alright, so today I'm going to be doing the cardiac peripheral vascular assessment on you, okay? And I'm going to be touching and listening to a lot of sounds, and that doesn't mean anything's wrong. It just means I'm just trying to get an accurate assessment. Do you have any questions before we get started?
No questions.
Okay, and at any point in time, if you feel uncomfortable, just let me know. Alright, so first you're going to start with your upper extremities and make sure they're nice and symmetrical, which they are. You have even hair distribution, alright? And your skin tugger, it bounces back, which is good. Your skin is warm and dry. Then we're going to do your radial pulse and your brachial pulse. Okay, good. Alright, now I'm going to look at your carotid arteries for any bumps, lumps, bruising, or pulsations, and I don't see any. Okay, good. So now I'm going to palpate your carotid artery. Okay. Alright, good. So now I'm going to go ahead and listen to your carotid arteries with the bell side of my stethoscope. And when I go ahead and listen to it, I need you to take a big breath in and then breathe it out and hold it, okay? Alright, so big breath, out, and hold it. Okay, you can breathe. And now I'm going to do the same thing on the other side. So big breath, hold it. Alright, good. Alright, now I'm going to check your hand grips. So just squeeze my fingers. Alright, nice and strong. Alright, so now I'm going to go ahead and check your chest area. I'm going to use the diaphragm of my stethoscope. Alright, we're going to get started with the second right intercostal space, which is your aortic. Then we're going to go right across over to the second intercostal space on your left side, which is the pulmonic. Your third intercostal space, which is your Erb's point. Your fourth intercostal space, which is your tricuspid. And your fifth intercostal space, which is your mitral. Alright, and I'm going to do the same thing, but I'm going to use the bell side, which is the small side of my stethoscope. Aortic, pulmonic, Erb's point, tricuspid, and mitral. Alright, good. Alright, so can you lay on your back for me? Okay, I'm going to check your neck for any jugular vein neck distensions. Look at me. Okay, you're good. Look at the wall. Alright, good. And you're good right there. Alright, now I'm going to go down to your pericardium area, which is the area that surrounds your heart. I'm going to check for any bumps, lumps, bruising, or pulsations. And you're good. Alright, so now I'm going to go ahead and palpate the area. Alright, this is your aortic, your pulmonic, your Erb's point, your tricuspid, and your mitral. Okay, so I'm going to do the same thing, but I'm going to listen to it with the diaphragm of my stethoscope. Aortic, pulmonic, Erb's point, tricuspid, and mitral. Okay, good. Same thing, just going to use the bell side, the small side. Aortic, pulmonic, Erb's point, tricuspid, and mitral. And the mitral is also your apical pulse. Alright, so can you turn on your left side for me? Okay, and then this is your left clavicular fifth metatarsal space, which is your mitral. Alright, you can lay back. Alright, and then now I'm going to check your legs, your lower extremities. So now we're checking, see these are symmetrical as well, which they are. You have even hair distribution, which is good. I see no varicose veins, and there's no edema when I palpate. Alright, and your legs are also warm and dry. Alright, so I'm going to go ahead, and can you just lay down real quick, just a little bit, so I could get your femoral, okay? And I'm going to check your femoral artery. I'm going to pulsate for your femoral, which is by your groin. Then I'm going to get the popliteal behind your knee. Alright, then on the inside of your ankles is the posterior tibial. And then on top of your feet is the dorsalis pedis. Alright, and do you have any questions for me?
No.
Alright, thanks.
I'm giving a report on a 16-year-old female patient who came in a cardiac and peripheral vascular assessment. We started with her upper extremities. Both arms were symmetrical with even hair distribution, warm and dry to touch, and her tugger bounced back and was good. Radial and brachial pulses were palpated equal bilaterally. Then we inspected her carotids. There was no bumps, lumps, or bruising or pulsations noted. We palpated one at a time. They were equal bilaterally. No murmurs or thrills noted. Hand grips were equal bilaterally. We checked her heart sitting with the diaphragm with good and the bell with good education, and we did it laying down as well. S1, S2 noted. No murmurs or thrills noted. We assessed for jugular vein distension. No distinctions were noted. Her pericardium was expected for lumps, bumps, bruising, or pulsations. None were noted. Palpated. We palpated all areas of the heart. There was no tenderness or pulsations noted. We did the apical pulse at the fifth intercostal space at the midclavicular line, and also her left lateral. And then we went down to her lower extremities. Both legs were equal symmetrically, equal hair distribution. Her skin was warm and dry, no varicose veins. And then there was no edema palpated. And then we checked her femoral, popliteal, posterior tibial, and the dorsalis pedis, which was equal bilaterally.